everyone, and welcome to Real Talk with Ellison. And I am Ellison. Listen, if you are on Facebook, we ask you to go ahead and please like our page. If you are on Real or on YouTube, we ask you to please subscribe. On Real Talk with Ellison, we talk about real issues that impact the community, the church as a whole. So, with that being said, we're about to get this show started. Hey everyone, thank you for tuning in to Real Talk with Ellison. I am Ellison. And listen, on today's show, we are going to be discussing the pros and cons of telemedicine. Y'all know how I do it. Before I bring on my special guest, I'm gonna have to give you some statistics. But I don't have statistics this time, so I just got something to say. So listen, over the last few years, we have seen a reduced access to care, surgeries, and other hospital services, combined with fear of exposure to the COVID-19 and other viruses. So all of that has led to a significant drop in access. So due to that drop, telemedicine has surged, right? It has surged as a feasible tool to maintain patient care and also to reduce the risk of such exposures to like the viruses and COVID-19, not only to just the patient, but healthcare workers as well as to the public. So here to give us, and I'm already cheesing, here to give us more inside view or inside view to telemedicine is my special guest, Dr. Brian Roper. You got an MD, a RPH, all that behind your name. Welcome to the show, Dr. Roper.
Oh, thank you so much, Ellison. Thank you for inviting me. This is a very exciting topic to me. Uh, I'm so pleased that you and your ministry and your husband's ministry is interested in telemedicine because it is a part of healthcare and it is here to stay. It will only get
Yes.
bigger.
Yes, it is. Yes, it is. So before we jump into, what our topic, the telemedicine, tell us a little bit about yourself.
Sure. Okay. Well, I'm Dr. Brian Keith Roper, Senior. I am a pharmacist and a physician. I've been practicing for about 25 years in the Jersey Shore area. I'm originally from New Jersey, but most of my education was in the state of New York, where I started off at Hofstra University, finished my pharmacy degree at Long Island University in Brooklyn,
Mm-hmm.
and then medical school. I did come back to New Jersey and trained at the University of Medicine and Dentistry, now known as Rutgers Medical School. Since
Rutgers.
I've been practicing here in the Jersey Shore area.
Okay, all right. You said Rutgers is my stomping ground.
Absolutely. Are you?
Yes, yes, yes. So listen, let's get in for our viewers, right? Can you, Dr. Roper, tell us what is telemedicine?
So telemedicine is a branch of telehealth, which is more of an umbrella under which telemedicine falls. So telemedicine is remote care in which someone seeks out care from a licensed medical professional remotely. This way, the person can be in the comfort of their home
Mm,
or wherever they're at on vacation and will not have to travel and can just go ahead and seek out medical care through a virtual waiting room. Through telemedicine, one generally can get treatment for minor ailments. And with the minor ailments, they, some telemedicine platforms the person will speak to the physician through the telephone. Others, it's through Skype or
Hmm.
some other modality such as that. So therefore, there's FaceTime actually.
Yeah.
And after that discussion, a prescription, if necessary, is sent to the pharmacy of that person's choice, or other advice is given in case if sometimes other things are needed other than just a prescription.
Right. So I can appreciate telemedicine because I know, not only with COVID, but after, I guess, after COVID, it was good because I didn't have to go to the hospital, so to speak. I didn't have to go to my doctor's office where I am now open to anything at this point, and then unfortunately so many people because of COVID, formed phobias. So I feel like telehealth was really, really, really good. Yeah, I feel
Yeah,
like she said telemedicine helped during COVID. I thought it would stay a strong path for medicine care. So thank you, Sabrina, for that. She said, I thought it would stay a strong path. Do you still see it as a strong path?
I do. I see it as a very strong path. In every field, technology is growing, and so medicine is a part of that. It will continue to grow. There are many different platforms out there. So telemedicine did not actually begin with COVID, nor did it end as COVID has died down or simmered
Hmm.
down, should I say.
Hmm.
It
Right.
is still around. It is still here, and it's just that the person has to know what to use telemedicine for. Telemedicine cannot be used for everything and anything.
Okay.
And anyone who promotes that is probably going to lead you down a terrible path as far as outcomes.
Okay. So I want to piggyback on something you said. You said that it didn't start with COVID, right? So can you give us some insight of how did telemedicine come into existence?
Sure. It's basically with technology and just advances through every major field in which with banking, persons able to scan a check and deposit it from their home,
Hmm.
and so many other industries the same. And so with telemedicine, this has been going on for a number of years prior to COVID. It's just that COVID gave it a big boost, and
Mm.
and that's where the majority of people started hearing about it and realizing about it. But there's been large insurers prior to COVID which would give access to telemedicine to their employees as part of a package of their healthcare. And so some people were already dialing into doctors, not going into appointments, and started to see the benefits of that. But it really got the boost from COVID when there was a lockdown of the entire world or the majority of the world. And that's where most people started hearing about telemedicine, remote health care, and different other modalities that were already in existence, but just were not
Mhm.
popular.
Yeah, because I've never heard of it at all, and then all of a sudden it just seemed like it just came out of the blue. So I can appreciate the boost because sometimes not only people with low immune systems or anything like that, but people who have busy schedules, just to have that Skype or that Zoom or phone call meeting, I think that's really good to have. So I think telemedicine is going to be around for a long time as people are just not wanting to go places anymore, or anything like that. So I have a comment, and it says, does telemedicine make the doctor's job easier in that they are able to see more clients?
Well, seeing more clients does not make my job easier. Um, it streamlines some things. However, sometimes I will get patients wanting treatment for things that telemedicine really should not treat for.
Ooh.
Unfortunately, some people will totally neglect the face-to-face and use telemedicine in areas it does not. So it does create some hiccups along the way. It streamlines things, so therefore I'm able to treat a larger number of patients per day than what I would be able to do with the face-to-face in the office. For example, as I stated before, with the remote visit, the patient can be anywhere and receive treatment. The same is true for the clinician. As long
Mhm.
as I have an adequate and stable Wi-Fi connection with the proper bandwidth, I'm able to treat from anywhere. So I'm no longer limited to the brick and mortar of my office.
Yes.
So I've treated patients from the privacy of my home. I've treated
Yeah.
patients while I was on vacation, while I was at a restaurant, if I'm in a movie theater, whenever there's a lull in the activity. So for me,
Right,
it
right. No, no,
increases.
no, 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 no,
Oh,
no, 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 no.
sis, you don't
I
put me
was
in a
with
timeout
you. I
already.
was with, listen, Dr. Roper. I was with you until you said I seen patients on vacation. No, no, no. Man, I was rooting for you. You said that. I was like, hold on. Because you right,
Yeah,
even in my my field, being a therapist, yeah, Zoom makes it easier. I can see you later in the day and I can do all of that stuff. You said vacation, I was like, wait, hold on.
yeah, 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 yeah,
But that's
yeah.
interesting because just like you go on vacation, people go on vacation too, and they, so things happen like that. So my statement is this: healthcare, right? The healthcare access refers to the ease with in which individuals can obtain needed healthcare, right? So that's what healthcare access is all about. It is generally defined as the opportunity to use appropriate services in proportion to healthcare needs. So, with that being said, you created and patented TetaMed, right? TetaMed is your own platform for telemedicine. So, can you please? I want to know all about that. Like, yo, you created this. I'm so proud of you already. So share with us like how and why. Where did this idea come from?
Okay, well, for TETA and TETA is an acronym for the Interim Doctor Act. So, just as it states, it's an interim service. It is not a permanent service. It was not created to take the place of your primary care physician. As a primary care physician, this was created by me during the time it was pre-COVID. I actually started thinking about this um, because a large portion of my patients, whenever they would lose their jobs, when a person loses their job, they lose their healthcare benefits. And just shopping in the neighborhood at the local grocery store, I would run into people who had not been in the office for quite a while. Sometimes I might remember their diagnoses. Other times I might remember the medication that they're on. And, we might have a short conversation around healthcare. And the person would reveal to me, hey, doc, I haven't been in your office because I lost my healthcare benefits. And then
Mm,
the conversation would continue as to, well, you are taking care of your health, correct? And then the person would reveal to me, no, I haven't been able to get to a doctor, so therefore I cannot get medications, which I need for blood pressure, diabetes, high cholesterol, and
wow.
so that had become very concerning to me, and I noticed that it was something that I saw more in the African American and Latino American community of my patients. That many of them would lose their insurance and would not have these benefits in order to come to me, and they would
Right.
say, "Well, I came to you about 6 months ago, and but I cannot afford the cost of paying out of pocket going to you or to
Yeah.
other doctors." And so that right there was very, very concerning to me. And so I kind of thought about, how do I decrease the cost of coming to my office,
Mm-hmm.
in which I can safely treat someone for minor ailments.
Good. That's good.
And this way they can at least be treated, in a way in which they can at least get refills of medications that we know that the person already needs. Now, I can't do anything about the cost of prescriptions,
Right.
but I could do something about the cost of seeing the physician. So I was looking at different ways initially, and reducing my fee, way, way, way down. However, it was
Right.
still quite costly for a person to come into my office, because I still have to pay staff members.
Right.
The rent has to be paid in the space in which I occupy, the
Yeah.
electric bill, the phone bill. And so there's a lot of there's just a
Overhead.
lot of costs that go with that.
Yeah.
The overhead is just very high for a face to face, and
Yeah.
that's when I came up with the idea. Hey, let me create my own platform, because some of the platforms that were already in existence, the platforms were, they cost a little less than a face to face, but it was still somewhere close to $100 for some of these platforms, and I
Wow.
felt that I could do better. And
Yeah.
that's when I decided to create my own platform, whereas I would be able to, get the cost down, way down, in order to make it affordable for just about anyone
Right.
to get a virtual visit.
Yeah, and I appreciate that, because you hear so much about the healthcare and the cost of it, and it's just, highway robbery, and people can't seek to get any care because they can't afford it. So I'm grateful that that you were given this idea and you came up with it, and not only was it just an idea, but you came. So viewers, if you guys are out there, hashtag Tidamed, TIDAMED. And then I went on the app, right? I downloaded it. So you guys can go on it yourself and download the app and support Dr. Roper. And we're going to get into that more. But, I think that is really good, because I remember one time I was away and I left my medication, right? So it says this is refreshing in the medical system that is money hungry. And that's how we feel. So I remember one time I was on vacation and I left my medication, right? And the hoops that I had to go through just to get my doctor's office first, then to get them to call the pharmacist, and then for the pharmacist to connect to the pharmacist where I was wore out. I felt like I worked a full-time job, right? So yes, y'all download the app. Download the app. So I say all that to say, it is really, really, really difficult. So what can or do you treat with the TetaMed platform? Right? Do you treat like any and everything? Enlighten us about what you do, what you can do through the TetaMed.
Yeah, so through the TetaMed app, we treat minor ailments or the symptoms of minor conditions. We also refill medications. So in case of a person is away and they forgot, simple things such as their thyroid medication, their blood
Mm,
pressure medication, diabetes, cholesterol, we will refill those medications for a person when they're away. So, for instance, Ellison, you had mentioned that one time you forgot your medication. There are people who forget medications all the time. They're getting ready to go on a nice trip. They're packing everything and they forget, and or they could be on the trip and perhaps their pill bottle falls into the
yeah.
pool, or pills spill onto the ground, and you got to just toss those out. You can't use those. A person knows their health condition. They know the dose
There's no
of their
5 second
medication.
rule in the hotel.
No, 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 not at all. You don't know who was there before you. You don't know what was on the bottom of the seat, or anything, or what was at
Yes.
poolside. So you're right. There is no 5 second rule, no 1 second rule. You will find yourself truly in a doctor's office if you practice that on foreign ground. So anything could happen with a person's prescription. And so therefore that person, sometimes they would have to go, as you stated, there was a lot of encumbrances trying to reach your doctor calling to the pharmacy calling another pharmacy. There's a lot of encumbrances there. And so with the app, the things that we treat. So we're treating people who have minor upper respiratory infection.
Mm-hmm.
So a cold, a cough, for instance, a person may have a urinary tract infection, an ear infection, some sort of throat infection, um, diarrhea, constipation, many things along those lines. As it was stated, we're an interim service. So we do have in our terms of agreement that the person is advised to seek out face-to-face medical treatment because
Mm-hmm.
someone calls us up and they use the app for a simple cough. Through the app, I cannot determine whether or not that cough is is just bronchitis versus something more serious as a tumor.
Right.
And I don't know, even though we asked the person to be honest and how long this has gone on for, sometimes a person forgets and they may minimize their symptoms. And so therefore we do advise the person that they should go out and they should see a licensed physician face to face within several days in case if they need a chest x-ray, in case if they need labs. So even in the course of what we're treating, we do realize that we are treating symptoms. I'm not trying to
Right.
diagnose through the app,
Okay.
and I'm not trying to replace that face to face, but it's an interim service. And so we will treat minor ailments such as upper respiratory, urinary tract infections, um, abdominal pain, diarrhea, constipation, minor aches and pains. We do not give out narcotics. We do not prescribe
Okay.
narcotics through this
Okay.
app. So therefore, and it states that in the terms of agreement. So therefore, a person looking for Percocet, OxyContin, oxycodone, you're not going to get it through our app.
Vicodin, all that stuff.
Vicodin, all of that type of stuff that's highly addictive, that is something that we will not give through the utilization of
Yeah.
our app. That would
So
require additional.
okay, so I did see where Sarita said, "Great concept, the best of medicine and technology." So the reason why I wanted to come back to that comment is because it's true. So everything you're saying, am I typing this in, or do I get to speak to a person? Like how? Elaborate a little bit more.
Yeah, so part of it, with the other telemedicine apps, it requires generally a face-to-face and a phone discussion with the doctor. Those are the ones in which I saw that the cost was still quite great because the physician's time, it was still taking a lot more time to do that. And so that's why with mine, I created mine is 95% texting. So a
Okay.
person will enter all of their data and it comes across to the physician who's on call in a text-like fashion. We built in there real-time tracking. So it will let you know when you are in the virtual waiting room. Then
Mm-hmm.
it will have the avatar of a nurse taking you to the virtual exam room. At that point, the person knows that the doctor is reviewing their case. And then it will let you know once the doctor hits complete, it will let you know that it's completed and you can go to your pharmacy. 95% of the cases that come through does not require me to call the person and to have a conversation with them. It's very clear because of the way I built the app, which has drop down menus. So even if a person is challenged by some medical spelling, the person is not required to spell pneumonia, is not
Right.
required to spell that they have perhaps sarcoidosis. We have things like that in our drop down menu. And
Okay.
so my platform is one in which it is the majority of it is texting. Sometimes I will have to call the person for further explanation, but that's how we've kept our costs down because ours is a text platform in which
Okay.
the majority of times we do not have to speak on the phone or do a Skype call.
So So how long is that process about? Is it a good, what, 5 minutes, 10 minutes? How long is the process from start to
Well, the
finish?
process, yeah, the process from start to finish takes about 15 minutes. However, a person may be in the waiting room a little longer. With our platform, though, it's not the same. Being in a virtual waiting room is not the same as sitting in a doctor's waiting room for 30 minutes to an hour. So if there's a lot of cases, your case may not be addressed for about 30 to 45 minutes. However, you're not just sitting there. You go on about your day. You continue doing whatever you're going to do. And you just check back on your phone periodically because with the
Oh,
real
that's
time
good.
tracking, there's nothing else for you to do. Once you've submitted your case, there's nothing
Hmm.
else for you to do but to wait for the notification that the virtual appointment is completed, and you can go to your pharmacy, or the doctor will give you a call at a certain time. So it's
Okay.
not the exact same, even though sometimes the wait from start to finish may be a total of an hour. You're not
Uh-huh.
waiting around for an hour. You're continuing about your day, and you just pick back up your phone an hour later if you have something to do. I've had patients who would send their case. Again, it's a minor ailment. They did not want it to impact their day. They'll send their case and they're going out to dinner. And so they may send a case at 3 o'clock in the afternoon. They're going into a meeting. They're going out to dinner. They're going out with friends. And then they check the app back 2 hours later, and it will tell them you can go to your pharmacy. So
Oh
as long
man,
as,
I like that.
yeah, so as long as you know how long your pharmacy is going to be open,
Right.
then that's how you will maneuver around that. But you don't need to just sit and keep looking at the phone every 5 minutes once you've submitted
Right.
your case. It's going to
Okay.
be taken care of.
Okay. So listen, if y'all haven't downloaded the app, right? iPhone, Team Droid in the house. Oh, anyway, iPhone Droid. Go to Tita Med, download the app so you'll have it and you'll be ready and you won't be on vacation talking about. Now I know I heard about it on Real Talk with Ellison. What was that app again? Download it now. Have it there ready. Right. So thank you so much, Dr. Roper, for informing us. That was some good information because unlike sitting in the doctor's office, we can go still be about our business, go on vacation, have fun. I did want to address the question about having. Do you think, or do you see a way to view medical records in the future for patients who use this app?
Yeah, well, the app is evolving as with anything else and everything else. So our app is evolving, and that is something that I do foresee in the future. I'm not sure of how long before we get to that point, but yes, I do foresee that it will be something in which there will be medical records. Right now, as stated, it's an interim service, and but I do foresee in the future that it could morph into that, in which medical records are available through the app, in which the person can go back and review different things. But right now, it's we do market it as an interim service only.
Okay, that's good because again, you could, I'm thinking about all the stuff, the my chart, whatever. If you could connect, all of that together, that would be fabulous. So Sabrina says, I like it because I don't have to go back to my health office for lab results. Saves me the driving time and copay just to be told labs and etc. like that. So how do you feel your app could benefit the community and even the church? What about church? Because we have millennials, we have baby boomers, we have the elderly. How can your app benefit the church in a way?
Well, the ministry of the church many times is ministry to those who are downtrodden, those who may not have health care, those who are marginalized in our communities. And many people seek out the church for fellowship that they may not get anywhere else. So, in many churches, especially those uh, churches that service the African American, the Latino American, and other social economically depressed and marginalized groups, many times
Mhm.
we'll have congregants who have either no insurance or have some sort of low insurance. That means
Mm,
they may have insurance, but they may not have easy access to someone.
okay.
And that can be part of the ministry. The ministry is not just to feed the spiritual, the spirit, but also the flesh.
Yeah.
How is it that one can minister to one's spirit when a person is hungry, when a person is sick? So I feel that this right here is something that the church can use this to help address those who have no insurance, or many of the millennials, they will take out what is known as catastrophic insurance. That means that they
Mhm.
have an extremely high deductible. So if they go to a doctor's office, that person will still be paying the full price as if they have no insurance until they reach that deductible, which may be
Mhm.
somewhere in the $5,000 to $10,000 range, and their insurance is only there to benefit if something really catastrophic occurred and they were in the hospital in the ICU for 2 or 3 weeks, in which the bill is going to come out to be hundreds of thousands of dollars, and so
Right.
therefore that $10,000 deductible then becomes a drop in the bucket. It's not a
Yeah.
drop in the bucket for the average millennial who, thank God, will not have a catastrophic event, but will
Yeah.
have a cold, will have a cough, will have a urinary tract infection. And let's be
Yeah.
honest, many, whether they're in the church or not, will have sexually transmitted diseases. Um,
Yes.
and these are things
Yes.
that we're able to treat at a low cost. And I tell students that come in all the time, my job is, and the same thing with the church. Our job is not to judge.
Yes.
My job is to treat, and the church's job is to treat and to heal. And
That's right.
because as I've told people, they're like, well, you know what, and I've had people come to me and will say, well, doc, I've had this, and this. I don't want you to think less of me. And I said, I remember the story of our Lord and Savior stooping down in the sand when they were
Come on
ready
now.
to stone someone. And he stooped down in the sand. And I said, you know what? I don't need someone sitting down and writing in the sand what my aggressions are, what my sins, what my grievances are, because we all have sinned and fallen short of the glory of God. And
Come
so
on.
my job is to treat, my job is not to judge. And there are encumbrances, I feel, sometimes with going to your primary care doctor.
Yeah.
There are, and I'm gonna come out and I'm gonna say this. Ellison, can I
It's
say
real
this?
talk with Ellison. Say it.
And I'm gonna get real for a minute. uh, when certain things, when you go to your primary doctor's office and you tell what has gone on in your life, and these things are written down in the chart. In the interim doctor app, it is a whole separate private chart. And
Mm,
I've been practicing for 25 years, and I've seen things from everybody, whether they're married, single, widowed, divorced, or whether they identify something other than their birth sex. I've seen it and I've treated it all. And again, my job is not to judge, my job is to
that's
treat.
right.
I've
That's
had
right.
people come in who are highly affiliated with churches. I've had people come in who have no church affiliation, all many doing the same thing. Not everybody, but many doing the
Right.
same thing. Um, and
Well, I know. I'm an LPC, so I know.
you, you hear it all. You hear it all. And certain things a person may not want in their medical record. And so I've had people, they'll come back and they'll say, well, off the record, doc, I went to an urgent care out of town because I've fallen short and this right here, and I did not want to bring this back into my home. And
Yeah.
I applaud them. And I'm like, I'm not applauding their action of what they did.
Action. Mhm.
I'm applauding that they sought out treatment and
And
they were
respond.
smart about how they
Mhm.
sought out the treatment. This
Mhm.
is how the app is beneficial. It's not something, we don't print this and put it in a person's chart. If the person is my medical patient, we call it's an interim service. So right now,
That's
there's no access to going back and getting that. So if a person is moving and a spouse says, hey, let me go get your chart from the doctor's office, the person's not worried about, oh my God, was this in the chart or that in the chart?
Right,
No,
right,
because
right.
they weren't treated in that fashion. And so I'm going to be real. The app has been used and is used for things such as that, because guess what? There is now the record with the app, what I've created with it, the medical record, what you've typed in, it does go to the email that you've selected, but it tells the person that in the terms of agreement that whatever
Okay.
email, if you select a work email and someone has access to it, you've given them access to your medical record. And
Yes. Oh
there's a
gosh.
way, if you want to opt out and you do not want that record coming to any email, there's a box you check. But you cannot
Okay.
come back to us afterwards and say, hey, can I have a copy of that? You've
Mm.
already decided that you do not want a record of it. You want to be treated and streeted and forgotten about. And that we can do. And that I have done many times, over
Yes.
the course. And,
I'm,
because
I'm
I did
excited.
have I did have a scary situation with someone. I'm gonna just tell this real quick. There was a gentleman. This was about 15, 20 years ago. A gentleman, uh, both he and his wife come to my office, and so he wanted to speak off the record because I started reading to him. He went to a specialist. I started reading to him what the specialist wrote. The specialist was writing about this married man and what happened somewhere else. And this was in a medical record. He was very much afraid, even though this was a one time occurrence. I truly believe it was a one time occurrence. I truly believe this was something he was not going to do again. I counseled him on that, and he was affiliated with the church. He wasn't a pastor, but he was affiliated with a church. And he was
It
embarrassed
happens
about
from the pulpit to the pews. It don't
it.
matter.
There you go. Absolutely. And he was saying to me, I don't need this to be found out. And so I showed him the record. And I said, what if you're moving and your wife orders medical records from all the doctors you see, and she's just thumbing through it, just to thumb through it? She's going to see that. And if it ever, or imagine one of her girlfriends starts to work for that specialist you went to, and you decided to tell all out of guilt. And this is how, you know what? Some people wait for an opportune time to put somebody on blast. Oh, you think you're this? You think you're this? You think you're that? Y'all got the big house, y'all got the big car, and boom, 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 boom. Well, let me tell you about your man. You know what?
Yes.
And so I explained to him, I said, you know what? Certain things, brother, you do out of town. If this occurred out of town, you get treatment out of town. You don't bring it back home, because
You don't
again,
bring
I
it
again, I don't
home.
believe, I'm not trying to condone his actions, but I'm not trying to see his marriage go up in smoke from a one-time event that I feel he's truly repentive of, he's truly
Yeah.
sorry about, and that it's not going to happen again. And
Yeah.
but he needs treatment. And so
Yeah.
the app does treat that. So you're not able to access records afterwards. No
Okay.
one else can access your records. So even my staff members who work in my office, if a person's a patient in my office and they use the app for something they just don't want in the record, my staff members cannot access the app. Even my wife, who is the office manager of my practice for the past 25 years, she cannot access the app and find out anything as far as what I have treated anyone for. Only I
Yes.
know, and only I have access to that.
That's good.
So
Thank you.
so
So
that
kudos to
that is the benefit
you.
of the app.
If Mrs. Roper is watching, yay for supporting.
Yes, 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 yes.
Yes, behind every good man there is a good woman. So thank you, Mrs. Roper, for that. So what I'm
Yes, I
hearing
thank
you
God
say
for my
is you
Eve.
true. You what you say?
I said, yes, I thank God for my Eve.
Amen. So what I I love it. So thank you for my rib, Lord.
Absolutely.
So what I
Put my
hear
rib to
you,
good use.
that's right. That's right. So what I hear you to say is I treat they, them, and everybody, right? And even ones, if I'm not mistaken, I think I heard uninsured in there, impoverished, and those who have been left without health, some kind of health care equations, correct?
Correct.
Okay, so I don't have to have Blue Cross Blue Shield, TRICARE, TRICARE Select, Optima, all that other stuff.
No, the app is actually, we call it, it's insurance agnostic. It does not care whether you have an insurance, whether what your copay is, whether you have a copay or whether you have no pay. It does not matter. The app truly is an equal opportunity employer.
Okay. I love it. I love it. I love it. So listen, if you guys haven't downloaded the app already, y'all messing up. Go on there now. Go in your Play Store and download T to Med app. So that there it is right there. T to Med, the intern doctor app. Go down and support it and support Dr. Roper. So how much, right? Because everything has some kind of cost. So how much is it?
So you have to compare it to coming to a doctor's office for a minor ailment. So a person who comes to my office for a minor ailment and they have no insurance, they're going to be looking at paying somewhere between $100 to $120 out of pocket.
Mm,
If that person has a copay, their copay is generally going to average somewhere between $15 to $20. Some a little less, some a little more. I had someone today who had a copay of $35. The cost to use the app is just under $40
mm.
for the same service. And when you bake into that equation the conveniences of being treated at home and not having to sit in a waiting room, so as stated before, you're able to put your case in and go about shopping. You can't come check into my office and say, "Hey, I'm going to go shopping. I'll be back in an hour." You come back in an hour. If your wait is 45 minutes in my waiting room, you
Oh
come back
well.
in an hour. There might be other people in front of you still. And so the conveniences of it, when you take all the conveniences of it, the cost of just under $40 is really a great savings.
Oh yeah.
There's the convenience of not having to drive to a doctor's office, the convenience of not having to schedule, the convenience of not having to go through multiple layers and the wait time and things like that. So I feel that this right here. So it's obvious when a person is uninsured, you're going to be paying less than half the cost because it
Right.
takes up all of the overhead. So you're paying less than half of the cost because the cost is going to be definitely over $90, somewhere
Yeah.
around $100 to $120 to see me with no insurance. And the cost for this right here. And but again, even for those with insurance, even for there are people who use the app quite often that have copays that are even $5, and they'll say, "This is just very convenient. I
Yeah.
don't have time." One of the situations we will have like people who are traveling out of town to lecture, and again, this is more convenient than going to an urgent care or to a walk-in when you're away from home, and you could use this for a minor ailment. So for under $40,
Yeah,
I
that's
feel that
good.
the benefits far outweigh the cost of the
Yeah.
services.
So you keep you keep saying for the convenience, for the convenience, for the convenience, and right now this world is all about the convenience, right? So like you were saying, under $40 to have your app to get your medication so that you can be taken care of. But what about situations like there was the COVID pandemic, and what was it, just less than a month ago? They had warnings that we couldn't even go outside because of the fires that was in Canada. The air quality was so poor, but yet you have people who have pulmonary problems and other disorders that they couldn't breathe that air. So how do you feel like telemedicine and even Med can help in situations like that? I think about hurricanes that I'm thinking about all of these catastrophic events that happen.
Yeah. So TNAMED was created for catastrophic events outside of healthcare. It's for minor ailments, but if there are different events that preclude one from going to a doctor's office. We know during COVID, there were a lot of deniers, COVID deniers, a lot of people who refused to wear masks. Now, in the setting of my office, yes, a person would have to wear a mask. That's
Mhm.
my fiefdom. I control that. So therefore, the person would have to wear a mask during that time.
Right.
There are many situations, as you mentioned, people with pulmonary conditions. There is COPD, chronic obstructive pulmonary disease. Some
Yeah.
people
Yeah.
have the emphysema component. Some people have chronic bronchitis. There are other
Hmm.
people who have immunosuppression for various reasons. Some people might be HIV infected, in which their immune system is malfunctioning. Other people may be on chemotherapy in
Yeah.
which suppresses your immune system. Others may have connective tissue diseases and autoimmune diseases in which prednisone is the hallmark of treatment, and prednisone is an immunosuppressant. So therefore, there are many cases, even outside of a pandemic, even outside of the Canadian fires that made the air toxic,
Yeah.
especially for those who were immunocompromised and those with lung diseases. Um, and so there are many reasons why a person may choose not to go outside, especially to a doctor's office. A
Hmm.
doctor's office or a hospital, no matter how often we try to sterilize it, a person can pick up what is called a nosocomial infection. You're coming to a place of healing.
Nosocomial, nosocomial,
Nosocomial, that's
nosocomial infection. Wait, hold on. Nosocomial infection. Okay, I got it.
okay. What nosocomial infection means is that the place you're going for healing, you actually pick up an illness. And that's basically what nosocomial means.
I'm staying in
So,
the house.
uh, but because in a doctor's office, no matter how much you try to sterilize, it's only as sterile as the last person who was there. You don't know why that person in this waiting room
That's
is
good.
is there. When you're sitting in an actual waiting room. Now, during COVID, once we were able to let people back into the office, we did space the chairs about, but you're still in a room that's somewhere about the waiting room is still somewhere about a 10 by 20 room
Yeah.
and everything. And you're still, even with a mask, there's a certain percentage of air exchange between you and the others who are there. Now there's no mask requirement, but there are
I
people.
know, not even in the hospitals anymore. Oh my
No,
God.
no, no, no. And so each person has to know his or her own vulnerability, in
Yeah.
which, if you know that you're immunosuppressed, if you know you have chronic disease, then you might still wear a mask. And so for my patients, we ask if they want me to wear a mask, I will wear a mask still, even though there's no longer a mandate. But we cannot control other people coming in the waiting room. So yes,
Right.
there are many reasons why a person may not want to go to a doctor's office for something minor, because they
Yeah.
realize that that minor ailment can
Gonna
turn
turn
into
into
something major, into a nosocomial
pseudomonial,
infection.
pseudomonial, what?
Nosocomial.
Oh, nosocomial. Oh my gosh. Oh, you just added something else to my plate. Anyway, so so I mean, but that is so true, because unfortunately, when you have a lot of different people coming from different walks of life, coming from different environments, all in one little 10 by 10, 10 by 12, whatever, then the air is being circulated, and sometimes the circulation is not well, so all the germs is being spread, everything is happening out there. So yeah, I'm appreciating the app already.
Yeah.
So listen, guys, if you guys haven't gone to the website, I challenge you to go to the website, learn more about Dr. Roper, learn more about how this invention came about, different things like that. So we have one of the before I go into my question, it says, do you provide translators for persons who do not speak English? That's really good. That was a good question.
That's a great question. Um, Part of the app, we haven't launched that yet, but we have the technology there. We have an auto translator that can be added, and so I've actually tested this. So, but the languages that were used, because the software engineer who originally worked with me, he's from Georgia, not Georgia, the United States, but from the former Soviet Georgia. So
Oh wow.
his language, he speaks Russian and he speaks Polish. And so he created it in which the client can choose their native tongue. And we did not put it into the most common foreign languages in the US yet, but they can use their native tongue. And so they're putting in their symptoms are coming up, and my avatar is there. I'm speaking German, I'm speaking Russian, I'm speaking whatever language there is
Let me
with
find
this.
out if Dr. Roper speaks.
Yeah, so it has me on there speaking about 3 or 4 different languages. The person
Man, that's
chooses which
good.
language. And so my avatar, and then the drop down screens are in their language. And then
That's
it translates it. So when it comes across to me, it comes across in English. That is
oh, that's
that is something that
fabulous.
we have we have we have implemented, we have
Hmm.
it in there, but we have not made that part live yet. It's still there are still a lot of bugs in it, and just the perfectionist nature of myself. I don't foresee us launching
No.
that for another year and a half to 2 years, but
Okay.
it is something that is allowed in the technology. Another thing
Okay.
that we do have in there. It's part of what was created with this. A lot of people will want a work note, a sick note for
Oh wow.
their
Yeah, I didn't
visit.
think about
And
that.
so the person will think, well, if I use the app, I can't get a sick note. Part of the AI that I put in there, the artificial intelligence,
Oh
part
Lord.
of that, what it
That's a
does
whole nother
is
show.
that it will give you a 2-day sick note signed by a physician, myself, and my chief medical officer, Dr. Lionel Anisette. You will get a 2-day sick note from the date that you've used the app. So if a person went on today and used the app, which
Hmm.
today is the 22nd of June, a note will automatically go to, again, the email that you chose. A note will go to that email, giving you 2 days off starting the day you use the app. So it will excuse you from work the 22nd and the 23rd for recuperation. Perhaps you need to go to your primary doctor face to face. You couldn't get in. You want treatment today, but just can't see the doctor till tomorrow,
Right.
which is
Oh, that's good.
one of our bylines. And so the person will get that sick note automatically
That's
going
real
to the email
good.
that they chose, and this way they can take that to their job. And
Yeah.
when they if they need to have that day off or the
Yeah.
next day, and
I
do
like
some
that,
people?
man. Get a doctor's note and everything else too. That's
Yeah,
powerful.
yeah,
So you said the guy that helped you was from like Russia and he spoke in or German. And you speak different language, your avatar does speak different languages, right? So when looking at your website, going to www.tidamed.com, I couldn't help to notice that the executives are either of African descent or African American, which is great. Like that is so great that, African Americans came up with, this, you yourself, African American, came up with something as so powerful as this, but yet is very diverse and it helps
yes,
all people. So
yes.
enlighten a little bit more about that.
Yeah. So, in developing the company, I wanted to pick the best and the brightest, and these were the best and the brightest in my area as far as um, coming together to put together an app, which I still consider the app to be in its nascent stage, in its infancy, and
Okay.
I've met some very talented people along the way in my travels, and so these are gentlemen that have specific skill sets in areas in which I'm not a subject matter expert in everything. So we have
Hmm.
an attorney. We have my chief medical officer. I chose not to serve as the chief medical officer as the CEO. So we have a chief medical officer. We have a chief financial officer. We have a chief information officer. So these are
Hmm.
people who are actually skilled in these areas and work in these areas outside of TETAMED. And so I brought them together, and the collective just happened to be African American. So I
Yeah,
feel that this is the best and the brightest in Black technology.
that's good.
It just so happens that, yes, that the crew, the executive crew is African American. But if one looks at the entire company, there are others that are involved in the company that are not African American, but the majority of those employed by this company are African American.
Okay. And I think, like I said again, I think that's powerful. And as a community, we were told, and I'm not going there because y'all, everybody that watches Real Talk know I go on a soapbox, but I'm not going there today. But we as African American are so busy, are told what we're not and what we can't do. So I think that's powerful that you did and you will continue to do, but it's not just for us as a community, but for people as a whole. But as an African American community, it is so important for us to support our own, and I have a problem with that, but I'm not going on my soapbox either again. So with that, with that being said, right, how is it the Black community can support this Black medical technology venture of yours?
Sure. Well, the download is free. So going on downloading Tita Med, if you have a smartphone or if you choose to have an Android. Sorry about the shade I just
uh
threw in there.
uh
I'm just kidding. Any smartphone, if you choose, downloading it, taking a look around, play our video, share it with other people. Perhaps you may have insurance, but there's a large segment of the African American community, of the Latino American community, of people who have just traveled, who have just migrated to the United States that do not have insurance. And a lot of them will neglect health problems. So help us help your community. And we don't want people to neglect their high blood pressure and end up with a stroke. We don't want people
that's
to
good.
neglect their diabetes and end up with an amputation or some sort of
Mm,
retinopathy that could lead to blindness, or neuropathy in which they get tingling and numbness in their feet due to not being treated. Because
yeah,
again, we can provide treatment on an interim basis for that person while they're perhaps waiting for their insurance to kick in. And some people, it's going to take a while for their insurance to kick in, but at least they can get low cost treatment for medical issues that they know they have, and
right.
avoid a complication, which we see far too often in our community.
Yes, yes, yes. So thank you. So yes, listen, you guys have been watching Real Talk with Ellison, and we've been talking with Dr. Ropa. He is the founder, CEO, all the above of the Tita Med app. And Doctor, I'm going to ask you for a nugget. So while you're thinking about the nugget, I want to say this, guys. It's important for us as a community, regardless to our race, our nationality, ethnicity, social, status, economic status, that we come together and we learn about our health. Our health is important. You only get one life. And I'm so grateful for Dr. Roper for creating the Tita Med, because, if I can't get there, I can still get some kind of help if I can't get to my doctor's office. So go again and download the app, right? The screen, the website is scrolling across the screen. So Dr. Roper, as we get ready to close out, please leave us a nugget about health, about Tita Med, and the telehealth.
Absolutely, absolutely. Um, as you so eloquently stated, we get one life to live. It is stated in the Holy Scriptures, it is appointed unto every man and woman to die once. And I feel that my job is to keep you here. My job is to keep you here as healthy as you can be. And so, therefore, we want you to get treated. Too often, we don't seek out treatment. Too often, there is mistrust in our community when we don't see someone who looks like us. We may feel that a particular office may not want us there. Sometimes that may be true, but many times it is not true. But if a person feels that way, the person is not going to seek out that treatment. We want you to get treated. We want you to treat your body as if it's a holy temple. Make sure you are getting the oil check. Make sure you are replacing the windshield wiper fluid in your body. Get checked for glaucoma, which untreated can lead to blindness. Get checked for high blood pressure. Get checked for your prostate. Get checked for get your mammograms done. We have the highest rate of breast cancer and deaths from breast cancer. We have the highest rate of prostate cancer and deaths from prostate cancer. And the same thing with many other malignancies. And a large part of that is that we are not going for routine surveillance, checking our labs and getting screenings done. So therefore, the nugget I can leave with you is to please get checked for different screenings. Get your colonoscopy, your prostate, your mammogram, your pap smears, your eyes checked. Get all of that done. And that's the nugget I will leave you with.
All right. Well, thank you so much for that nugget. And listen, he done said some big words. I'm not even going to try to repeat them, but what I heard was get checked.
Get checked.
Get checked. So, Dr. Roper, hold on a minute. We're going to put you behind stage and we'll be right with you, right? Listen, guys, you have been watching Real Talk with Ellasin. We have been talking with Dr. Brian Roper Sr. He is the creator of the Telemed app. If you haven't downloaded it, go and download it now. And we thank him so much because he has given us a lot of great information of how we can take advantage of telemedicine, right? And even the Telemed app. So listen, coming up next, right? So we've been talking about men. We had Men Talk all month long. The month of July, we're going to talk about marriages. We're going to talk to different people, different platforms across the board about marriages. So you're not going to want to miss it. Tune into Real Talk with Ellasin Thursdays at 7. If you have not subscribed, what are you waiting for? Go ahead and subscribe and tell a friend that Ellasin be on Thursdays at 7 p.m. Thank you so much for watching Real Talk with Ellasin. God bless each of you. Mwah.